Hello, everyone, and welcome to the Homeopathy Hangout podcast, where today we get to hang out with a lovely Dr. Elisa Song. Welcome to the podcast, Eliza.
Oh, thanks so much. I'm honored to be here.
I have been following you for a little while, and you've been on lots of other podcasts sharing your incredible knowledge, including the amazing Alex Stewart's Low Tox Life podcast. And I've been wanting to get you on the podcast for ages, but you had a little baby that was on the way that has been birthed called
That's right.
Healthy Kids, Happy Kids. And I'm excited for us to talk about that today. But firstly, I always ask my guests, how were you first introduced to homeopathy? But in your case, you've got a medical background. So maybe just give us that whole story of how did you come to do what you're doing?
Yeah. Well, and really and truly, when we think about all the different healing modalities that can be used, I will say for me, living in Silicon Valley in the San Francisco Bay Area, homeopathy is the form of medicine that really is probably met with the most skepticism from my parents at first when they're not familiar, right? Because it just sounds like, oh, is it placebo? Is it a sugar pill? And so really educating them about, how homeopathy really is its own science and own medicine and that there is good evidence to it is really important because I've just seen such profound differences that homeopathy can make for, especially for me as a pediatrician. It's so safe and gentle for babies and for children and, can be so effective. And so how did I get into it? When I started medical school, it actually was with this desire to be more of back in those days, it wasn't called integrative pediatrics. It was called alternative medicine. But I always had this passion in me, starting from college when I was really looking at what I want to do with my life. And I know I always want to work with children, but coming from a medical home where my mom was an OBGYN, I just thought, oh, I don't think I want to do medicine. It's just, I mean, the time and the stress and the effort. But knowing that I want to work with kids, I started going down a path of maybe being a teacher or, being a civil rights lawyer. And, the right teacher comes when you need it and when you're open to it. And it was in that moment where I was just deciding what I really, really want to do with my life, where I ran across a flyer for the American Holistic Medical Association. And I must have been maybe 19 at the time, I took myself to this conference not knowing what I would find, and I was totally hooked. And from that moment, I remember calling my mom and saying, you know what, I think I want to be a naturopathic physician. And it really just informed, even though I ended up going to a very conventional medical school and a very conventional pediatrics residency training, that initial eye-opening conference really informed how I want to practice. And eventually I found homeopathy and that became, I took I remember a 40-hour course for physicians. It was through the American Institute of Homeopathy. And so I started dabbling in it and, getting these amazing results with kids with earaches or kids with fevers and being able to really reduce the use of medications like antibiotics. And yeah, and then I was just hooked. So it's been a part of my practice since the very beginning.
Wow. And you're also a lecturer, I saw on your website for the Center for Education and Development and Clinical Homeopathy. I haven't even heard of that. What is that?
Yeah, so CEDH, so the Center for Education and Development in Clinical Homeopathy started in France and actually, has very close ties with the homeopathic manufacturer Boiron. And so they started a school of homeopathy for physicians to be able to bring that into their practice. And it was decades ago. And since then, CEDH has opened up branches in many different countries to teach practicing physicians how to incorporate. And instead of going, back to homeopathy school, let's get in the training in a year and learn how to really use it in your practice. And so I am a teacher for the CEDH USA program. And at this point now, the CEDH USA program is the largest homeopathy CEDH school in the country. But there are international conferences every other year. And I'm blown away. I remember, gosh, was the last conference. I was not able to go to the last conference in Brussels, but I did go to the one prior to that in Barcelona and I spoke and taught. And there were physician homeopath from Tunisia and China and, all over the world. So it's spreading. I mean, it was a huge conference, and it was so interesting to see how other clinicians around the country are able to incorporate homeopathy into their practices and even into their hospitals.
Wow. You've just made me realize. So that is that Christophe Merville from Bourne?
Yes,
Ah, okay,
yes,
because I've
that's
had him
right.
on the podcast and I remember him saying like they're training, but I didn't realize that that's what it's called. So you've kind of put the puzzle pieces together for me
That's right.
now.
So Christoph is with Boron, and so they're separate, but Boron does help, sponsor many of the venues and the conferences and help support the teaching arm, which is great.
Awesome, amazing. He was actually such a beautiful guest to interview. It was like a couple of years ago he was on the podcast and he's been with
Yeah,
me for
he's
like
amazing.
about 30 years or something like that. He was lovely to chat to. For anybody watching on our Rumble, I don't mention the YouTube thing anymore because they deleted my channel and I'm trying to get it back.
Oh, oh my gosh.
For
Okay.
medical misinformation. So anybody watching on Rumble, just behind Eliza is her beautiful book, Healthy Kids, Happy Kids. And I just wonder, can you tell us a little bit about why you felt this book was important to write? And even before you say that, I just want to put in there, it's such a good book for parents. You made it so easy to understand. I just feel like it's one of those books. I feel there's a few books that when a baby is, or actually when a mum is pregnant, there's a bunch of books that should be shoved in their hands. I feel that this is one of those books.
Oh, thank you. And I'm honored that it took a while. My book was just published in May of 2024 and it was released I think in October in Australia. So now it's very easy to get in Australia. So, I mean, why did I write the book? I mean, they say there's some saying that, is it 80% of people say they want to write a book, and then really when it comes down to it, only about 3% actually write the book. And, it is definitely a labor of love. It is the most intense pregnancy and birthing process I've ever gone through. I mean, it makes having Kenzie and Bodhi look like a piece of cake. And so, but I'm so proud to have this book out. And why did I write it? I wrote it because after 20 years of doing this and having still every day parents calling the office asking, is there any, holistic pediatrician near me? Can I come to see you? Is there anyone who can help my child? And I mean, my practice has been closed for years now. As a solo practitioner, I just don't have the time to see more patients if I actually want to go home and have dinner with my kids, But at the same time, it's so important to make sure this information gets out to not just parents, but also practitioners. I mean, one of the most inspirational things for me is when a fellow pediatrician writes to me and says, I read your book and my eyes are so open now and I can't believe I didn't know this, but now I'm going to start to get more training so that I can help patients in a different way. And so it was really to get all of literally the 20 years of me doing this, every single thing that I've learned through research and clinical practice to get it out there on paper so that parents and children can have it in a really easily accessible way. I mean, I really, it's so important for me to make things practical and memorable and fun, but also have the research there so that parents trust that there is science behind what I'm writing about and recommending, and also to get more practitioners on board, more medical students, more doctors, more nurses to say, oh, this actually is something that we should know about, especially given the crisis of chronic disease that our kids are facing.
Absolutely. And it's going to be hard for things to change unless physicians learn this sort of stuff in their training. It's so
Yeah.
important. But something that you are really good at is the research. And whenever I listen to interviews of you, you're always quoting research wherever you go, and you find
Mm.
the most interesting research. And obviously in the book as well, quoting a lot. One of them that really blew my mind, you were saying about the Scottish physician that tested the microbiome like 100 years
Oh,
ago, which is actually
yeah.
interesting because you obviously know the homeopathic bowel nosers from, Bach and Patterson. And was that
Yeah.
who you were talking about, by the way? That wasn't the guy you were talking.
No,
No,
this was,
okay,
gosh, what is his
because
name?
that
I
was
can't
also about
remember
a
this.
hundred years ago,
Yeah.
and just our microbiome looking so different then to now. Do you maybe want to talk a little bit
Hmm.
about that? Because I found that really interesting.
Yeah. Well, for the listeners, I mean, many listeners, know that, especially for children, the health and development of their gut microbiomes really informs how their immune systems shape, how their brains develop, how their hormones and metabolic health is shaped. And it really starts with the microbiome that infants develop from birth. And we know that one of the factors that underscores a lot of the immune imbalance that we're seeing and the brain imbalance that we're seeing in infants and toddlers and young kids is in large part due to the loss of a specific bacterial species called bifidobacteria, right? That's one of our beneficial probiotic species. And there are many, many different strains of bifidobacteria. And so this Scottish pathologist 100 years ago looked at baby poop and they compared the microbiomes of exclusively breastfed infants compared to formula-fed infants. Now, formula at the time, I have no idea what it looked like at the time, but there was infant formula at the time. And what he found was that breastfed babies had almost completely 100% bifidobacteria probiotics in their gut, as opposed to the formula-fed babies who had more variety. So they did have bifidobacteria, but they had a greater diversity of microbes. And in infants, that greater diversity is actually not beneficial, unlike in adults where we want a lot of diversity. Now, fast forward 100 years now in the current day, and the microbiome of our exclusively breastfed babies looks much more like the microbiome of the formula-fed babies 100 years ago. So this is where we see, I have parents and moms who come to me and their babies have eczema or maybe asthma, or they're developing signs of ADHD, and they're saying, "Oh my gosh, but I mean, I ate so cleanly during my pregnancy. I had a natural delivery, vaginally birthed, breastfed. I mean, all the quote right things, and yet we still see kids tipping over into chronic health concerns. And, I think that really stems from, in our modern world, our microbiomes are just different, and we need to do what we can to support and nourish really balanced and resilient microbiomes.
I think sometimes for me as a practitioner, because I'm homeopathically trained, I did a little bit of naturopathic training. I've been in practice since 2012, and what I'm finding more is how important it is for homeopaths to actually understand more of this naturopathic type of stuff. And since I've been doing the
Yeah.
bigger scan, I'm learning more about this and realizing there's so much more to learn. I mean, I'm sure you're the same way. We never actually stop learning. But something that a couple of years ago, all this stuff was starting to come out about people who had recent medical interventions, because I don't want my newly created YouTube channel that I'm trying to upload my 300 videos to get removed again. But there was some people that had had their gut microbiome tested before the intervention and then days after the intervention. And they found that during that time, their bifidobacteria went from X amount of bacteria to zero amount of bacteria, which was really, really scary. And so
Yeah.
then I ordered the homeopathic remedy made from bifidobacteria in like like a
Hmm.
12C potency from our local
Yeah.
pharmacy to start experimenting with that a little bit. Because how would you even go about building that back up? And yeah, maybe I'll just start with that one. Like if you've had antibiotics or your gut microbiome has been compromised in some way, what would you say to parents to try and yeah, get that back up?
Yeah. That is fascinating to think about.
Scary as well.
Low dilution of bifidobacteria. That is fascinating. I hadn't thought about that. But, there are ways that we can support bifidobacteria, even apart from taking. I mean, there are, many, many different probiotic supplements on the market, many, and some of them are better than others. But you will be able to find probiotics with multiple bifidobacteria strains. And that is important because even within the bifidobacteria genus, there's many, many different species and many different substrains. Now, one of the best ways to feed bifidobacteria, to have bifidobacteria colonize, is to feed them. And one of the most fascinating ways now that we're finding good results is feeding them with something called human milk oligosaccharides. The fascinating thing with breast milk is that breast milk is chock full of a specific prebiotic called HMOs, human milk oligosaccharides, that only feed bifidobacteria. It just shows you how important evolutionarily bifidobacteria was, because our breast milk was designed to feed this bifidobacteria. And so now you can find commercially prepared, manufactured HMOs. You're not drinking someone else's breast milk, but you're getting this HMO product that then has been shown, to really help colonize and increase your bifidobacteria levels. And I think that is one of the best ways, yes, you can take a probiotic supplement, but probiotics are only going to colonize if they have the food and the environment to really nourish them and nurture them. I mean, it's just like thinking about growing a tomato plant. You can't just sprinkle tomato seeds on the ground and just leave and walk away. You need to nourish the soil and get the right water and the right sunlight. And so, same thing with our microbiome. We have to think about it as an ecosystem that needs to be nourished and nurtured. And how do we protect our ecosystem? And first, that's with fueling it with all of the things that are required for healthy bacteria to grow. And then the other part is really keeping away the factors that will disrupt your microbiome. So, I mean, we already mentioned medications like antibiotics, but there's antacid medications. There's ibuprofen, which is a non-steroidal medication that's used for pain and fever, and our ultra-processed food. I mean, our highly processed food additives, food colors, artificial food dyes, artificial sweeteners, too
Mm,
much added sugars, non-organic foods that are
mm,
sprayed with glyphosate, all of those wreak havoc on our microbiome. So learning how to live a microbiome friendly lifestyle. I mean, in my book, I call it, we need to learn how to live like gut heroes and create that microbiome magic every day with the decisions that we make. And it's not a difficult process. It's just understanding what steps to take and making sure that we really take those steps.
My homeopathic brain is just going, thinking, I need to find these human milk oligosaccharides in a low potency and combine them with a bifidobacteria in low potency and start
Yes.
giving that to people.
That would be amazing.
I really do love that, like that we've got the power with homeopathy that we can, use all these variety of different remedies alongside supplements. Like Ton Janssen really likes to do the homeopathic remedy alongside the supplement to increase the absorption because sometimes the remedy's not enough by itself. And sometimes if you have supplement absorption issues, then it's tricky taking the supplement. So that's why I also
I
like
mean,
homeopathy.
yeah, I've had such great experiences with, for instance, I mean, zinc is one of the most common nutrient deficiencies in children. And we know with zinc deficiencies, there are lots of sensory issues, auditory, cover the ears, the bathroom fan or the flush is too loud, or you can't, vacuum or do the blender in the house, or maybe jeans or pants. Clothes feel funny, tags on the shirt bother you, certain smells. And so that's a big tip off for me that your child needs more zinc, right? And so whether zinc through food or zinc supplementation, if your kids have eczema, poor skin healing also is another sign of needing zinc. And when you check kids' blood levels, oftentimes their zinc levels are quite low. And we'll start a zinc supplement, but it's not enough to move the needle sometimes to bump up their zinc. So then you give the zinc and you add homeopathic zincum metallicum, and you get phenomenal results. And sometimes the Zinc metallicum alone is enough to really resolve those sensory issues, the sound, the touch, the smell, and all of that. So I think there's such a great synergy when we can find the right combinations. I mean, same thing with iron. I've done that with iron supplementations and ferrum, and it's opens a lot of, I think, windows and opportunities to really help heal our kids.
Low zinc is such a big one. I've been doing Oligo scans for about a year or so, and I've done about 300 scans, and I consistently see low zinc. It's just like everybody's
Yeah,
low in zinc. It's almost red
it's
meat to be
true.
high. But then what really clicked in for me is I didn't realize that zinc is so important to create good stomach acid. And so you get these kiddies with low zinc that then have low stomach acid that then become really picky eaters because intuitively, they don't want to
Yeah.
eat a lot of food. And so
Yep.
This feels like everything is such a mess. It's so hard to clean
Yeah.
all of this up. Where do
Well,
we start?
I know. And then, zinc is also, zinc is so important for stabilizing mast cells. And so when there's histamine and allergic responses, which are increasingly common as well. So I love zinc. As far as minerals go and supplementation goes, zinc, I probably see some of the most remarkable changes. I had this one mom whose child was, literally eating maybe four different foods. And she heard me on another podcast talking about zinc and picky eating and sensory, aversion and feeding aversions. And then I mentioned all the other signs of zinc deficiency, the other sensory issues, maybe getting sick more frequently, itchy skin or eczema skin. And she was checking off the boxes saying, oh my gosh, this describes my child. And so she started a zinc supplement, and she said literally within 1 month, just 1 month of taking the zinc supplement, her child had tried maybe five different foods and was starting to expand her diet. So, it can make it can be that quick. And of course, with homeopathy, sometimes we see even quicker, right? Sometimes that's like immediate, right?
Well, also the flip side, because I'm just thinking of all before I knew about this link with the zinc and the low stomach acid, I was classically trained, but that very quickly changed in the last few years since the podcast. My mind's exploded. But I'll try and treat this child classically for like picky eating, and nothing would work. And I think that is where,
Yeah.
as homeopaths, we need to know the physiological reasons behind why. And they just like, I don't think that one constitutional remedy is going to fix it. When their stomach acid's low, you need to give them a zinc supplement. And that's where sometimes our training
Yeah.
has got a bit of a gap in it, I think. These days, maybe, even 10, 20, 50 years ago, maybe that constitutional remedy might have been enough. But I feel like these days there's so much onslaught from all directions that we need to kind of use this integrative approach where we're taking it from all
It
angles.
makes sense because as we're thinking about what's happening, on a cellular level and really energetically, not in like a woo-woo sense, but really, we can see these changes. And if your bloodstream and your cells are just really kind of mucked up with toxins and debris, it's similar to acupuncture that really works on those lines of energy for me. You get better results, I truly believe, when we can do a little cleanup first. If you have a child with so many food sensitivities and they're really inflamed, sometimes we need to do a little gentle detox first or remove gluten. And then all of a sudden, the remedies that you've tried, they start working better, or acupuncture starts working, even better. So I think that is one of the reasons for me that I think that these modalities tend to work better with children than in adults because adults just have more long-standing sort of toxicity and sludge, so it makes it harder to move.
Absolutely. Something else as I'm learning more, like I said to you before we start, I've got a few like personal questions I want to ask you of things that I'm stuck in my clinic. But one of them is, with leaky gut and biofilms and parasites and
Mm.
yeast and mold and all these things, where do we start? Like as clinicians, where do we start healing these things? Because it feels like these days everything I'm seeing is all about parasites and all about,
Yeah,
you know,
it's true.
and like where do you even start?
Yeah, it's true. There's like the latest thing, right? Years ago when I was starting my practice, it was all about candida, right? And it is true now. It seems it's all about, it was mold and parasites. And so, which are these? Well, one of my main focuses first, before I start doing any of the more aggressive treatments, is you have to build up the foundations because I'll see some kids who, or parents for that matter, who see practitioners and they've gone straight to the killing. Let's take SIBO, for instance, right? Just straight to the antimicrobials, whether they're herbal or prescription. And when you're in that depleted state, it just makes you react more and makes you feel worse and doesn't always lead to healing. And so, my approach is always build up first, and then there's less to kill, right? Because your own body is starting to do what it's meant to do to reach a better, healthier equilibrium. And then we go for the parasite cleanse or the yeast cleanse or the biofilm busting or the mold detoxification or whatever it is. It seems so simplistic for families, but I mean, you have to get down to the basics of how we're living and eating and thinking every single day. And that means, yeah, no, you can't have a Starbucks Frappuccino every day. And, and think that healing is going to be easy. And yes, we do have to prioritize restorative sleep and movement and hydration if we want to have an easier time to healing. So getting those foundations set, replacing nutrient deficiencies, and then working on the other pieces that need to be sorted out.
I wish I could make my clients understand the importance of sleep.
Yes. That,
Because
I mean,
it
you,
just doesn't get prioritized. And especially for children, like I always ask about, people bring their clients will bring their children in for behavioral disorders and all sorts. And I'll ask what time the child goes to bed. And they're like, oh, yeah, about 9 or 9:30. And it's like a 7-year-old. And I'm like, my 13-year-old's asleep by 8:30.
oh,
So,
yeah. Me
um,
too.
yeah, I just wish people could understand the importance. And so many clients will complain about things being like supplements being expensive. It's hard to do this or that. Going to bed early is something that you can do free of charge.
That's right. That's right. And, really, when you look at the data behind, sleep, I mean, it is quite alarming. I mean, when you look at the brains of teenagers who aren't getting adequate sleeps, and, in some studies, the teenage brain really needs at a minimum of 9.5 hours of sleep. Most of our teenagers are getting 6 to 7 hours of sleep, maybe less if they're up all night on their screens, texting or playing games. And that lack of sleep will start to show up in shrinkages in parts of your brain. Now, that's scary, right? The same thing with ultra processed food. A steady diet of ultra processed food in children has been shown to shrink parts of their gray matter. And even, everyone's seen a model of a brain with all the folds start to smooth out. And so, that can be reversed, but you have to understand this synergistic effect when we're on our screens. I'm talking about our kids, and most kids who increase screen time has been correlated with increased junk food consumption because you're just mindlessly sitting there, eating snacky foods. And so those ultra processed foods and the screen time can affect the brain and the microbiome, which that has long-term impacts on their behaviors, their immune health, their hormone health. I mean, these lifestyle factors, as I mentioned before, they're simple, but sometimes the simplest things are the hardest things to implement because they're things that we actually have to do consistently instead of just popping a pill. So, if you could bottle up the benefits, the health benefits of sleep and exercise in a pill, I mean, you would have your magic pill right there. I mean, that would be, the cure for so many ailments, but we have to put in the work. And I think as parents, especially, I used to do this. I no longer do this. I mean, sleep is absolutely a priority for me. And I was only half joking because oftentimes I am asleep at 8:30 and my kids now are kissing me goodnight because there's no way I can stay awake. But there was a time that I, like many, many moms do, once the kids are asleep, you feel like, oh, this is my time. The end of the day, it's quiet, and you feel like, okay, this is my time to have a glass of wine, sit on the couch, mindlessly watch whatever show you're watching or scroll through your Instagram feed. And before I would know it, I mean, the kids would be asleep at 8:30 and then all of a sudden it's 11 or 12 or later. But I was determined to do that because it was my time, and now you have to flip that script because sleep is also your time. In fact, sleep is when your brain is, in a sense, almost more metabolically active than when you're awake. And it's in your sleep that your brain lays down memories. It's in your sleep that your brain actually shrinks by almost 60% to be bathed by something called the glymphatic system to detoxify and clear out whatever toxins it was exposed to during the day. So really looking at sleep as, yeah, that sleep is me time, can change so much. I mean, since I've committed to, sleeping on the nights that I can, which is most nights, at by 9, maybe 9:30 at the latest, the changes in my mental clarity and my mood and, efficiency are remarkable. And I want that for everyone. I want that for every mom.
I would have to say I only treat women and children, and that's the story of every single mum in my clinic with a young child.
Hmm.
Exactly what you've said. That nighttime, it's me time, it's binge watching Netflix, scrolling, and wine. And exactly what you've said, flipping it, it makes such a huge difference.
Yeah.
Um, I did not know about the brain shrinking that much while you're sleeping, and I did not
Yeah, I
know.
mean, it is remarkable. And when you realize that, you're like, oh, there's a reason you feel crummy and toxic when you haven't had enough sleep, right?
I'm finding myself sitting here stressing because I already I have so many questions for you. I'm just like, how do I prioritize all of this? One of them, well, two things kind of just tied in with what you said, and one is the teenagers being on their screens and stuff, and also just how the gut microbiome affects mental health, especially for our
Yeah,
like everyone, but the teenagers, I feel they are so vulnerable because they're on social media, they see all these things, but they don't know the role that their gut health plays in their mental health and all the neurotransmitters that are made in your gut. But then
yeah,
also, I'm going to put that in there. The gut microbiome has its own circadian rhythm, which I did not know. I heard you say that in the book or the podcast or somewhere. I heard you say about the gut having its own circadian rhythm. So I just want to throw
yeah,
those two things at you and do with that what you
yeah.
like.
I mean, it is so fascinating. Our microbiota, I mean, when we think about who really runs the show here, we think about our microbiota, their job really, as we've evolved, are to keep us healthy and happy, to create all of these amazing byproducts when they eat the food that we consume. If it's beneficial food, if it's filled with fiber and phytonutrients, then our microbiota, the beneficial flora, will take those nutrients and create byproducts that we need to survive, like vitamin B12 and folate and vitamin K and butyrate, which is a short chain fatty acid, which is considered our master regulator of health, and our neurotransmitters. So our probiotics make maybe at least 80 to 90% of our serotonin, which makes us feel happy and calm and relaxed and helps us sleep. Our gut microbiome makes 400 times the melatonin than our brain does. 400 times, right?
I did not
And
know
also,
that. That's
yes,
amazing.
yep. And also makes dopamine, which is important for attention and focus, acetylcholine, which is important for processing speed, and GABA, which is also another very calming neurotransmitter. And so all of these chemicals and substances that we rely on, vitamins and minerals, those are, I mean, I'm not going to say every single one of them, but the vast majority, many of them are made by our probiotics, but that relies on us having a healthy gut microbiome in order to make those for us. Because we know that not all probiotics make serotonin or dopamine. There are certain strains that do. And if we're lacking those strains to make serotonin, well, it's no wonder then that oftentimes we see a child who has anxiety or depression put on an SSRI medication, and maybe they feel better temporarily because the medication is tricking the brain into thinking there's more serotonin around. But if there are no beneficial bacteria to make the serotonin that the medication needs to act on eventually, as is a very, very common story, we see treatment failure. I mean, treatment failure is more the norm eventually with antidepressant, anti-anxiety medications. And so, working on the gut is so important. I forget what your second piece was. We
The
were talking about the gut
circadian, the
brain
circadian
and the
rhythm part of
circadian
it.
rhythm.
Yeah.
Yes. Well, now that is fascinating that our microbiota does have its own circadian rhythm, which makes sense. It's a living organism, right? And, all living organisms are not equally active through all parts of the day. And, many of our microbiota are actually more active at night, and they're doing their work for us while we're sleeping. So when we don't have an appropriate circadian rhythm and we're not sleeping at the time when our microbiota should be awake, our microbiota then doesn't have the opportunity to be awake for long enough to do all the things that we want them to do. And so, it's not just when I talk to kids and families about the things that we do on a daily basis, I let them know we're not just doing it for ourselves. I mean, don't just sleep or exercise because oh, it's good for me and I'm just going to do it later because I don't have time. It's because we need our microbiome need that. We're doing it for our microbiome and for ourselves. And so for some kids, that really does actually make it easier for them to start implementing some of these changes and prioritizing things like sleep and movement when they recognize, all kids learn about the ecosystem around us, our world that we take care of and we reduce and we reuse and we recycle and all of that. And they learn that. And on Earth Day, we celebrate, we have to take care of the world so the world can take care of us. And it can be one of those sort of aha moments for kids to realize we have that same very similar ecosystem living inside of us. We have the one out in the world around us, and then we have the microscopic one, but it's the one inside of us that is just as important to take care of. And so I've had some kids really, make different decisions because they know, oh, I have to take care of this ecosystem. Otherwise, I'm not going to be as healthy and happy as I want to be.
I think it's so important from the moment your child's born, doesn't matter if they can speak or not, to explain to them why they need to do certain things, because that gives them that autonomy of their own body and helps them be in tune with their body, which is so, so important. I'm glad you mentioned butyrate because this was on my list of things because it's not something I had ever heard of until recently. I've got a boy with autism, nonverbal, about 10 years old, and he came up with extremely low butyrate. And I hadn't
Mm.
heard of butyrate before because, like I said, I'm a homeopath. I'm like starting to learn a little bit more about interpreting gut microbiome tests because I'm seeing that things are not shifting if I don't treat the underlying cause. And I said to this client, who's a really good client, for seeing him for a while, I'm like, there's this low butyrate thing on your kids thing. I don't know how to treat it, but it looks like there's a supplement because we can't buy butyrate as a supplement in Australia. So this is where the
Oh,
beautiful part comes in. She's ordered it at high expense from America. You guys have the
yeah.
best supplements. Honestly, it's so much stuff that we can't get over here. But what is this butyrate thing and how on earth am I going to treat it in this kid?
Well, so one of the things we know that there are butyrate producing microbes. And so when we think about how do we get those up, the majority of butyrate producing microbes are not ones that you can really take in a supplement. So, there's one called Faecalibacterium prausnitzii and then Rosaburia species. They are some of our primary butyrate producers. Now, butyrate, it's a short chain fatty acid that is made when these particular probiotics ferment whatever fibers are coming down, the GI tract to them. And then the byproduct of this digesting of the fiber is butyrate. And butyrate can support a healthy gut lining. Butyrate can help to keep out, abnormal pathogenic microbes. It helps support brain and cognitive function. It helps support metabolic health. I mean, so many, many different benefits. It supports immune health. And, I have seen it described as one of our master regulators of health. I mean, just so important for our overall functioning. So you can take butyrate as a supplement. It smells terrible. I mean, and so it can be difficult for kids to take. I mean, if you can swallow pills, it's no problem. But there are some liquid butyrates that are available. Again, I mean, the taste to me is not great, but it's manageable. And you can also support the growth of these beneficial bacteria that create butyrate for you. And one of the fruits that's been found to do that is kiwi fruit, especially gold kiwi fruit. There's even a kiwi fruit, there are two kiwi fruit extracts, supplements that have been studied to increase butyrate production. So maybe, and they're actually from New Zealand, so maybe that's something that you could get instead of getting the actual butyrate in Australia.
That sounds amazing. I'm actually getting goosebumps as you're saying that, which I always get goosebumps when I know, yep, that's on spot on. So I'm definitely going to do that for this book because also obviously the child has got, I'm not sure if it's encoprease or what it is, but loads of little bits of poos throughout the day, which, they're not
So
going to
that
do the
sounds
toilet
like,
by
oh my
themselves.
gosh,
So the mum has to clean undies all day
yeah.
long. It's hard. It's hard.
I think this, so there's a green kiwi fruit extract and a gold kiwi fruit extract. And I can't remember which one has which benefit because one of them is by the same company, a New Zealand company, but one of them has been found to increase this Faecalibacterium and butyrate production. The other one helps with constipation and with bowel movements. And so that could be really good for him.
Amazing. Thank you. Oh, that's exciting. Can we also just talk about what on earth a healthy bowel motion looks like? Because in all these mummy groups and stuff, I see them talking online and they're like, oh, no, my kid doesn't go it only goes every 3 days. It's normal that my doctor says it's normal. But even can we start right all the way back from like breastfed babies? Because even breastfed babies will sometimes go a week or 10 days without having a bowel motion and they're told that that's okay. And then later on, I'm always blown away by the amount of adults that come to me. Oh no, I only go to the toilet about twice a week, and they think that it's normal because their GP's always told them that's normal. Can we just talk about
Yeah.
what does a healthy bowel motion look like?
Yeah, yeah. Well, I mean, babies are a little, when babies are born, they have a very strong gastrocolic reflex. So gastro means stomach and colic is the intestines. And so pretty much every time you put something in their stomach, it causes that intestinal waving, that movement, and they squirt something out, whether it's a big poop or a little squirt or some air, right? Some gas. And we know this as moms, like when our babies were nursing, all of a sudden, like right as you start nursing, there's poop that comes out or a big loud fart, right? I mean, whatever it is. That starts to, and we as adults, we still have a gastrocolic reflex as we get older, but usually it's just in the morning after we breakfast, or for some, it's also at nighttime, right? Now, that will start to slow down for babies. And so, after a few months of age, they're not necessarily pooping every time they eat something, right? And, breast milk is much more, it's just highly absorbable and usable than formula. And so there are some babies who, breastfed babies, who don't poop for a few days because they're just utilizing their breast milk so much, right? All of that's getting absorbed. And then they may have a massive poop like once every few days or so. I don't worry about that as much as long as babies are still nursing very comfortably, normally. Their appetite's not lower. Their belly is not completely bloated and distended. They're nice and soft bellies and they're comfortable. They don't feel uncomfortable at all, right? Those babies who, over the course of a few days, you notice their belly's getting more and more bloated, they're kind of squirming and, scrunching up their legs, and they look like they're more gassy and uncomfortable. Well, then that's showing me that they're not tolerating, not stooling more frequently. For formula fed babies, typically don't stool as often, and you are more at risk for getting even a little bit actually constipated and getting harder stools. I mean, baby poop should be anywhere from like liquidy to pasty, but should not be balls that you can roll off the diaper. Once you become a toddler or a kid or an adult, we really want your poops. And there's, in my book, I have something, a diagram it's called the Bristol stool chart, and you can easily Google that online as well. There's different, type 1 through type 7. And the ideal type is looks like a smooth brown banana or a smooth brown sausage, just very smooth. It's one piece and it doesn't float. It sinks down to the bottom of the toilet. It also can be considered normal if there are certain like cracks in that stool, in that poop. Maybe it's not quite, maybe it looks more like a corn on the cob, right? But as opposed to a banana. Once you're getting to bigger clumps that are stuck together or actual clumps in the toilet, that's more constipated. Even if you're stooling every day, I would say that's still too hard. And then, once it starts to become more like pudding or gravy or liquidy, I mean, that's diarrhea. And so we really want that stool to look healthy, right? And we also want poops to be at least once a day. If it's a really good looking poop and it's every other day, that's acceptable. But, we should be passing our stool, the waste products from our food that we don't need anymore on a regular basis. And so if you're not pooping at least every other day, there's either some issues with motility that we need to work on. Sometimes it's not that there's not an urge, but it's just the need to, from a lifestyle standpoint, slow down so that when you have the urge to poop, you actually take the time to sit and relax on the toilet instead of go, 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 running to, school or running to soccer or running to, whatever it is. And sometimes it's a matter of really working on stress management skills because when we're stressed and we're in that fight or flight and all of our muscles are tensed, ready for that fight or flight response, then, I mean, the last thing your body is going to want to do is stop and poop, right? Can be a whole variety of factors. Oftentimes, kids need more fiber in their diet, more water. Magnesium is another very common nutrient deficiency that often needs to be replenished. And of course, there's so many homeopathic remedies that can be great for constipation. I mean, Nux vomica I use fairly frequently because I mean, a lot of constipation nowadays, even in little kids, is because they're just on the go, 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 and just and have that stressful lifestyle.
Absolutely. You made me think of something else as well because I always wonder about like kind of time of day as well because I kind of feel like when you wake up in the morning, you should have a bowel motion and then like, well formed and daily. And to me, that's kind of like a sign of like a healthy gut because I feel like we don't really know what's normal anymore because there's so many allergies and illnesses and seems like
Yeah.
histamine everywhere, people not pooping like, and that seems to be the new normal. So I feel like people need like a little bit of a retrain. But you made me wonder about that circadian rhythm. If maybe people aren't having a bowel motion in the morning, maybe if they're not getting to bed early enough, the little microbiome, the gut bacteria don't get a chance to do their job. So then you're not ready to go in the morning. But do you think it makes a difference on time of day that you go, or not really?
I mean, probably not so much. I mean, most people are going to go in the morning. Some people will go at nighttime. I think whatever is more consistent for you.
Mm,
I mean, again, it's most common in the morning. If
mm,
it now, with the caveat, if we have the time to really slow
mm.
down and eat something and get that reflex, that gastrocolic reflex going. But so many people just rush out the door, and how many teenagers rush out the door without breakfast and they just, I'm not hungry and, run to school. So that is something that we have to watch for because, you mentioned Miralax. I mean, Miralax is just not something that we want I don't know if you mentioned Miralax, but Miralax do you have Miralax in Australia?
I think it's probably is that type of thing that makes you go to the loo. We've got similar things
Yeah, it's
over here. I'm just trying to think of what the name is over here, but I know what you mean.
Well, so Miralax is polyethylene glycol, right? And I mean, very similar to antifreeze that's used here. And it is used for constipation. Now, it has never been studied for long-term use in children in kids under 18 years of age, and also is not indicated for use in adults for more than 2 weeks. And yet these children are being put on Miralax for, I mean, years and years and years and told, oh, there's no problem with using Miralax indefinitely. And parents have no idea when I tell them, it's actually not approved for children at all. Right? If you look
I
at
think
the,
it's called Movicol over here. So Movicol. So it's from what I understand, like kind of almost petroleum based, and because the body can't absorb it, it like pushes everything through. And
yeah,
I
yeah,
have loads
yeah.
of clients that are from infancy on it for months at a time.
And that I'm just, one of the things with, I guess, Movicol and Miralax is there are many reports of neuropsychiatric complications from its use. So much so that the FDA did call for an investigation into it, but there's really hasn't been much movement in towards really investigating these important side effects, but it is noted. And so I think, any parent who is told that it's okay to use it for long-term use, the first question is, well, why isn't my child pooping in the first place? not just putting a Band-Aid on, trying to get stools moving, but let's look and see, let's try to figure out all the different potential root causes so that they can actually poop on their own and their intestines can do its own thing.
I just want to jump back to something else when you were saying about the Bristol stool chart. Something I often get my clients to do is print out the Bristol stool chart and also the urine chart. Like you can find that online as well in color, laminated, put it up on the toilet wall so your kids know what's a
Yeah,
healthy. And actually, I saw this in Bali in the public toilets at the airport. They had the urine chart up on the toilet wall. And I'm like,
really?
imagine every school in the whole world has a Bristol stool chart and a urine chart up on the stall wall so
Oh my gosh, that
children
would be
know
great.
what healthy pee and poop look like.
Yep.
So cool. And then I quickly, before I know your time's up, but I quickly want to squeeze in there Spore-Biotics. I hear about that everywhere these days. Is it a fad or is it worth trying out?
That is a great question. I have adult parents who feel great on spore-based probiotics and are doing really well. There really, unfortunately, is not a lot of pediatric data. Now, there is some good adult data that spore-based probiotics can restore the gut microbiome. After antibiotics, they can be very helpful. So I do think that there's a role, absolutely. But I haven't used it widely in children. There are some pediatric studies, but I haven't used it widely yet in children just because I'm waiting to see, well, what are the indications and, how effective are they for pediatric populations? It's also the thing, just as we talk about probiotics, it's interesting. I used to, this is now when I started my practice 20 years ago, I would tell everyone, oh, yeah, we should all be taking a probiotic supplement every single day. And I don't say that anymore. What I think we really need to be doing is nourishing and feeding our beneficial flora in our gut and focusing on prebiotic and phytonutrient rich foods and eating fermented foods, right? As a way to really naturally get in those probiotics and those postbiotics like butyrate and GABA, and then using probiotic supplements really on a targeted basis, after antibiotics to replace the beneficial bacteria that have been killed, or if your child is dealing with any mental health concerns, taking probiotics that we know specifically are strain specific to increase serotonin and dopamine levels, or there are specific strains that through the winter have been studied to reduce the rates of fevers and flu-like illnesses. So really when we're targeting those, and then we don't take them forever. We get those in to try to support the need that we have. And then we want our own bacteria, our own beneficial bacteria to take over as well. Because each of our microbiomes is so unique. I mean, just like our fingerprints. And it just doesn't make sense of the trillions of microorganisms in our gut that we can narrow it down to, even if it's a broad spectrum probiotic with 16 different strains, that's the tip of the iceberg. So using them judiciously, using them as needed for specific indications, and then relying on food, lifestyle, mindfulness to really support a healthy gut microbiome is, I think, the best way to go.
And I love that in your book and your whole ethos is about making this all kind of like fun and not so serious and not beating yourself up and having that mum guilt if you do need to use antibiotics. And in your book, you've got a list
Yep.
of questions that you can ask your doctor if they want to put you on antibiotics, finding out if it's viral, bacterial, the questions that you can ask so that you're making an informed decision. Something else I really love in your book, you've got these like which microorganisms are related to certain like autoimmune type conditions, which you
Yeah.
might not have thought of. So if you have a client with like multiple sclerosis, there's actually a bacteria that you're probably going to have an overgrowth in your gut. And instead of just treating the symptoms, actually going right to the gut and treating that like that specific bacteria, help like knowing where it's coming from. I feel like your book is just packed with so much incredible information that every single person needs to have it and read this book just to educate us on the most basic but most important thing. And the more we're learning about the gut, the more we're reading that's actually our main brain, right? And actually, the brain is the second brain.
Yep. Yep.
And how unbelievably important it is. So, have you got a specific place that you prefer people purchase the book? Is it best just through Amazon? Or I always ask authors because I've heard that there's sometimes hardly get any money for their book if somebody buys
Oh,
from a certain place. So I just
yeah.
want to make sure that the author lets us know where's the best place for us to buy from to support them.
Yeah. I mean, thank you for asking. I think it doesn't really matter. It's wherever you can easily find books. I mean, the vast majority of people buy their books on Amazon in this day and age, right? And it is available on Amazon Australia now. But if there are any local bookstores, I love supporting our small, local bookstores. And, I actually had a mom who was visiting, I believe she was from Bulgaria, and she sent me a photo saying, "Look, I found your book on the bookshelf here." And so, the more that we can and support small and local independent, as opposed to huge chains, I love. But I would say wherever's easiest for you.
Amazing. I definitely need to chat with you afterwards about doing a bulk order so that we can stock your book as well. I've got a few books that of
Mm.
practitioners that we stock, and I think this is such a vital one. You also have your own range of supplements, and I heard Alex Stewart, one of my I'm such a fangirl. I just love her so much from Low Talks Live, talking about how she loves your SPM supplement. But you've got a range of supplements as well. You've got the book, and you share amazing info on your socials. Can you just quickly give us like a little rundown? I just don't want to miss any of the places where people can find you.
Yeah. I mean, the best place to find me is my website, healthykidshappykids.com. And I'm most active on Instagram, which is healthykids_happykids. And my goal for 2025 is to, just do more posts and educational content for families and for practitioners. And I do have a supplement line. I'm creating a custom children's microbiome supplement that I'm so excited about. So I will keep you posted on that.
Amazing. I love things that are formulated especially for children because it can be hard sometimes. And you can use sometimes an adult one and just kind of like reduce it for the child, but it's not if it's gut microbiome. You've just taught us how important it is that the child's microbiome is so different to the adult. So that's amazing.
Yeah.
It has been a dream come true getting to chat with you today, Eliza. Thank you so much. Is there any final little message that you want to leave our listeners with?
I would say I'm just so honored to be able to be in front of you and chat with you and hopefully provide a little education and inspiration. And so, we are all in this together as moms and, just grateful to have this opportunity.
Amazing. Thank you so much for your time.